chiropractic adjustments can help impact that. So I did want to point out on the chart behind me, showing all the nervous system, that's going to show, which organ connects to what area of the spine and how the spinal nerves can and do impact function. Now, 10% of your nerves actively feel pain, the other 90% control that function. So, a lot of times with headaches, dysfunction or dysregulation of the nervous system is something that can impact headaches. So, we're specifically going to talk about this area at the base of the skull, how the neurology goes up into your skull, all the way on the top of your head. There's nerves that go directly behind your eyes, so it can affect like ocular migraines or headaches that light becomes more sensitive because that is sensory input coming into the nervous system. But where the neurology goes, it also can have an effect on the vagus nerve or nerves going down here. So tension headaches with the muscle right here called the levator scapula. Levator scapula goes up to 1, 2, 3, and 4. So that's a muscle going from your shoulder blade to the top part of the neck that can cause a pinch at the back of your skull or really posture. So here's here's a spine model. This is just the base of the skull. So you have to envision a whole skull on top of it. When your neck is balanced in a 45-degree curve, there is no nerve interference. The nerves at the back of the skull can flow freely. Now, let's say a person gets stuck forward. What happens is when you look up, then it jams right at the back of the skull there. So you can see how that would impact the nerves coming out of the base of the skull. Now, if somebody has just a very straight neck, it can jam as well, or it can even go the opposite way when a person has a reverse curve. So then instead of jamming at the base of the skull, it becomes overstretched. And actually, a reverse curve like this can put tension on the spinal cord, which is taking a rubber band that should have slack in this position, pulling it all the way tight. So full spine chiropractic adjustments or spinal correction, that process of restoring the curve can absolutely help to relax muscles, open up neurology, and have less tension on the nerves themselves. Now, as you're doing that, and I will acknowledge nobody wants to hurt, right? Or nobody wants to have a headache or deal with a headache that lasts long or lasts multiple days, or even a tension headache can then turn into or trigger something like a migraine. So if you're having this, of course, get adjusted. That is by far our biggest tool for helping that. But if you have access to the home equipment, the neck traction does a very good job of opening that space, specifically at the back of the skull. And I want to give you two tools that you can use at home in between appointments. If it was Sunday, if our office was closed, for how to help with your headaches. So one, shout out to Dr. Mario on this. He talked about what's called a still point inducer. So it's like a small, it's like two balls that sit next to each other and put pressure. So you can buy one of those on Amazon, 10 to 15 bucks. And it points right here at the base of the skull to relieve tension. Now, we talked about the neurology in this area, but there are 6 muscles that attach the back of your skull to the upper part of your spine. They're called the suboccipital muscles. So for you at home, what you can do is release them. So you can either use your middle finger or your thumbs and lay flat on your back and hold pressure there. After 10 or 15 seconds, you want to shift positions and lay back. You can hold this for up to 2 minutes, just making sure that you change places. But there are 6 muscles here. If you release them at home, if you have a bad headache, that may help open your sinuses. That may help reduce the intensity of your headache. Now, this next one, I'm going to show you how to do this. You can do this at home. This is a fascia release. So sometimes headaches show up in the side of the head here. This bone in the center of your skull is called the sphenoid bone. So we actually have an adjustment for that. You have to ask your doctor if you need that or not. But I want to show you a fascia release. It's called the antler horn, or the deer antler. So the reason it's called that is at the end, we'll end with our fingers pointed up. So you actually want to take one hand on one side and start with your fingers pointed back, and one hand on the other side. Start with your fingers pointed forward, and then you're going to squeeze and twist until both hands are pointed up. Now, in this position, you want to slow inhale out through the mouth. You can move your head around. Slow inhale out through the mouth and hold that for about 30 seconds. You'll mess your hair up, but it's worth it. Trust me on that one. You'll find the sore spots, the tender spots. Again, you want to roll your hands like this, ending up pointed up. And then you want to do the opposite on the other side. So big squeeze, breathe, move. That will significantly reduce the tension in the side of your skull. So there's two that you can take for at home: the back of the skull or the base of the skull, using either your fingers or what's called a still point inducer, or a fascia release for the side of your head. Now, those are always going to be more effective after getting a chiropractic adjustment. So hope that helps to give you some tools for at home and keep you happy, healthy, and strong.